Auscultation of the heart. Before this procedure, you must greet the patient, introduce yourself, take adequate consent, establish trusting relationship with the patient, create comfortable conditions. Room should be warm and clean. Diaphragm of stethoscope must be also warm. Make sure to wash your hands. Then put on gloves if you have, and last one, choose correct position in standing or sitting. It depends from condition of patient. Begin from the areas, firstly supraclavicular, and compare them. Next one, subclavian, alum parasternal or mid-clavicular line. From the left side, it's region of short intercostal spaces. You finish it because there locates heart and trauber space. And you continue to the down. Then ask patient to raise his hands in this way, please. And armpits region from both sides. Also compare sounds. Okay. From the back side, from supraspinatus region, upper right side, upper left side, then in the region of paravertebra or between shoulder blades. Avoid bones. Then supraspinatus, suprascapular to lateral direction. In this way, you must auscultate patient. Normally, over the lung, you can auscultate, you can hear vesicular sound, and from the back side, bronchial sound. If will be some pathological processes, there can be pathological murmurs, noises, decreasing or increasing vesicular sound. Depends from the diseases, depends from the condition of the chest. Thank you.